I'd now like to turn to our Program Development Award, which celebrates the innovation and collaboration that are foundational to the success of UT Southwestern. This award recognizes a group of clinical faculty and staff who've worked together as a team to create, develop, and sustain an innovative program that significantly advances our ability to improve the care received by our patients. We'll present 2 awards this evening, beginning with the Breast Reconstruction Program for our breast cancer patients here at UT Southwestern, which is led by Dr. Sumit Teotia. I know how to pronounce your name, sorry, just tired. And Dr. Nicholas Haddock, Associate Professor of Plastic Surgery and Orthopedic Surgery. The Breast Reconstruction Program is distinguished not only by its sheer volume, they've done more than 2,100 microsurgical reconstructions over the past decade, but also by the quality, safety, and the impressive clinical and cosmetic outcomes that this program is known for. As a result of their efforts, patients experience a lower length of stay following surgery, and complications after breast microvascular surgery have decreased by 73% since the beginning of the program. There are operative techniques, which many of you may have heard about through the many formats that the work has been presented at UT Southwestern, has reduced the average operative time to right around 4 hours against a national average of right around 9 hours. I know from personal experience, having had many of my own patients cared for by them, how fortunate patients feel to have access to these compassionate physicians and their team whose skill and artistry guide their breast reconstruction during the most difficult of times. We'll turn to the video now from Dr. Teotia and Dr. Haddock.
Microsurgery is taking tissue from one area with blood vessels and moving it to a different area. The reason it gets the term microsurgery is because we hook up these blood vessels under a microscope. So we're able to do total breast reconstruction with living natural tissue that will last forever.
The program is an amalgamation of several surgeons here, and it involves colleagues at different levels, from surgical oncology to radiation to residents to nursing staff and the anesthesia staff.
I'm more of the engineered, process-driven, whereas Teosia's kind of on the other end. He's more creative and artistic, and people see us as pretty opposite, but it works incredibly well.
You'll see 2 conductors, and that's how I see myself and Dr. Haddock. The partnership is thriving because of that creativity, because of that technical, mechanical, engineering, and ultimately artistic nature of our work. And that's the unique collaboration. And it has to align perfectly well with lots of moving parts and how we're going to coordinate our operative team and environment to make that happen.
We've grown this program with really the goal of improving outcomes, improving the process for patients. Ultimately, what that means for the patient is our operative times have drastically decreased. The data's out there. We know that if we have shorter operations, people have less complications and they get back to normal life quicker. And that's ultimately the goal, right? Is to restore someone back to what they had before they even started this whole process. Thank you, Dr. Warner, Badowski, Dr. Lee. It's a true honor to receive this award, and thank you for your leadership as well. You know, as we saw in the video, this is the 2 of us stand up here today, but this is a massive team, ranging from more in our department to the Cancer Center to Clemens, and really we are holding the award, but it's a lot more people that are involved. I think that's really important to say thank you to those people and for everyone that contributes to the breast cancer care. The exciting thing for me where I stand is, you know, looking at this and looking at our program, in my mind, we're just getting started. So it's exciting. I think we anticipate more growth, more innovation, more collaboration across the entire campus. So it's a very exciting thing. As with anything, it takes a lot of hard work. So my parents are here. I thank them for giving me the drive and the support. I think my wife, Emily, my 2 daughters, my son couldn't come, but Beatrice and Sam are both here. Thank you for your patience. This has been many long hours. Thank you for your patience, your continuous support, and love. I'll turn it over to Dr. Teotia.
thank the leadership for this this honor. I know it's 30 seconds, but I'll keep it very brief. So the real story for this program is, I showed up to Texas in 2009, probably the same time as Dr. Podolsky did, and I promised myself I was going to be here 2 years, and then I'm gone. But East Coast to Texas was quite a difference. But I mingled here and had a family here, and so the way the program started was very serendipitous. This breast reconstruction program parallels sort of my life, and so I met the most important person in my life in Texas, my wife Stephanie, who's here, and she happened to be a plastic surgeon in West Texas. So I did the most grievous thing any surgeons would do: married a referral doctor. It didn't affect the program; it only made it better, because of all the love, the groundedness, and the dedication that the family provided. And then meeting Nicholas Haddock, too, as my second most important person in Texas after, made this program even better. So I'm really grateful to my family. My son was born here at Clements, and my mother-in-law is here. My other son, Joshua, and Alexa is home. And so I'm really, really grateful, and this program is just incredible. So thank you so much.